everyone. Sydney here. I'm going to be doing a quick little lecture over pertussis, which here in America is also known as whooping cough. But in China, they call it the 100-day cough. And that is because the cough is so severe and it seems like you have it for so long that it seems like it takes 100 days. And I can agree to that. I can attest to it. I had pertussis at the age of 10, which I'll tell you a little bit more about later. Pertussis is a respiratory illness. It's also very contagious and it's only found in humans. The bacteria, which is right here, is called Bordetella pertussis, and the bacteria will attach to the cilia that line parts of your upper respiratory system. And then from there, the bacteria then will release toxins which damage your cilia and cause your airway to swell. As you can see from this picture right here, the bacteria are gram-negative bacilli. So if you go to the doctor, I sure hope that for your sake, that whatever comes up in his gram test is not gram-negative bacilli, because that could indicate pertussis. The transmission is only through humans, and also only humans get this disease, so that kind of makes a whole lot of sense. It is spread by coughing, which we see this little guy coughing out some pertussis. It is spread by sneezing or by sharing breathing space. So sharing breathing space with a newborn baby or sharing breathing space with a loved one can give someone pertussis. The disease progression, there are 3 stages to pertussis, which we'll go over right here. The Catterall stage lasts anywhere from 1 to 2 weeks, and a lot of times the symptoms just look like a common cold, nothing more. Symptoms of the pertussis at this stage are runny nose, nasal congestion, low-grade fever, occasional cough and red watery eyes, and then an apnea in babies. And symptoms of a common cold, look, we see the same ones right here. Runny nose, sore throat. We actually didn't see sore throat, but cough, which causes a sore throat. Low-grade fever, watery eyes. So very much just looks like a common cold. A lot of times people with pertussis will go to the doctor's office and the doctor will just say you have a common cold. I went to the doctor twice and he told me that I had a common cold. Finally, the 3rd time, I was in the paroxysmal stage, which is stage number 2, and he was able to diagnose me with pertussis. So here in the paroxysmal stage, that's where more of the symptoms of pertussis begin to appear. It can last anywhere from 1 to 6 weeks, but it may extend up to 10 weeks if you are not vaccinated. And the symptoms are paroxysms, which are fits. And these fits of coughing are so severe and intense that it causes a high-pitched whoop as the person that has pertussis is trying to get some oxygen into their lungs because they've been coughing so hard and for so long that they need the oxygen fast. Like I said, the coughs are super duper severe, and so a lot of times it causes vomiting just because you really don't have control over your body. And it causes exhaustion. Now, the 3rd and final stage lasts about 2 to 3 weeks, and at that stage, you're very susceptible to other respiratory infections just because your body is so weak and so exhausted of fighting from that pertussis that it just increases your susceptibility a lot. The coughing lessens, but the fits can return, and coughing fits are also more common at nighttime, and so a lot of times you'll still get the coughing fits at night in the convalescent stage. Now, how they diagnose for pertussis. It's not very fun. So the lab test, what they actually do is they take a cotton swab, which is really just a thin piece of wire with a teeny tiny little bit of cotton at the end, and they take that all the way through your nose into the back of your throat. It doesn't feel too great. It goes all the way up there, all the way to the back of your throat. And they use that by taking a sample of your mucus. The blood test to check your white blood cell count. If it's high, then that indicates that the patient is fighting off some kind of infection. They also might do a chest x-ray to check for inflammation or presence of fluid in the lungs. And fluid can indicate that you have pneumonia, which pneumonia, 23% of babies that are treated for pertussis in hospital actually do get pneumonia. So that's why that one is so relevant in being tested. But also, babies treated in hospital, 61% will get apnea, and apnea is slower stop breathing, which is kind of scary because the baby might not breathe for a really long time. And also, 1% of babies actually can die from pertussis. Of teens and adults treated in hospitals, 33% have weight loss. This weight loss is from not being able to hold down food because the coughs are so severe. But also 28% have a loss of bladder control, like I said, because the coughs are so severe. And 4% get rib fractures just because you're coughing so gosh darn hard that your rib fractures. Big old coughs right there. Medicines to treat pertussis once you already have it. There are antibiotics, and these can make the infection less serious. And the treatment can also help prevent the spread of the disease to your close contacts. But a treatment after 3 weeks is really unlikely to help the patient. A doctor may recommend over-the-counter cough suppressants or a codeine or something similar to codeine. And what that can do is that can help make the coughs not near as severe as they were without it. I was prescribed codeine whenever I had pertussis, and that really helped me sleep through the night. Here we have number of cases per year in the United States. So considering that we now have 325 million people, relatively low number at pertussis, which is pretty good. In 2009, which was the year I got it, I was one of the 16,858 out of 306 million to get pertussis. For preventative measures, vaccines. Vaccines are the most effective method to prevent pertussis, which, believe me, you want to prevent this. Babies and children get DTaP, which is a common combo vaccine of diphtheria, tetanus, and pertussis. And you get this at ages 2 months, 4 months, 6 months, 15 months, and 4 to 6 years. At age 11 is whenever you get your first vaccine of Tdap. And Tdap is preventative of the same things. But I got pertussis at age 10, so a year before I needed my next booster. It had worn off. So my experience with pertussis, that is the very first time that I threw up from coughing. Fun stuff. It was at my uncle's restaurant opening, so it was fun. Lots of laying down when you have pertussis. On vacation, clearly I was having fun there. I woke up the next morning and I had peed the bed because coughing so hard I lost control of my body. And there's me on the first day of school, ready. My desk was at the back of the room so I could go and cough if I needed to. So my take home from this, get the vaccine. I can promise you pertussis is not something you want. Stay on schedule with your vaccines. Some vaccines sometimes wear off and you get unlucky just like me, but the best thing you can do to keep yourself from getting this is to get the vaccine. Thanks for watching.